Hi, everybody. This is Elka. Today I'm going to talk about yoga and diabetes, how yoga affects blood sugars and other risk factors associated with type 2 diabetes. Here's my disclaimer. The information in this video is for informational purposes only and was produced for a class project. The creator is not a medical professional. The student, faculty, and university do not guarantee the accuracy nor reliability of the content, nor should it be a substitute for professional medical advice, diagnosis, or treatment. If you have questions about a possible medical condition, please contact your physician or qualified health provider. Never delay seeking treatment nor disregard the advice of a medical professional due to information you receive in this video. A little bit about myself, why I chose this subject. I worked as a nurse for almost 10 years, both in hospital settings and in long-term rehab settings, mostly with geriatric patients. And I saw a lot of people with diabetes, and it seemed like every year there were more and more. I've also been practicing yoga for about 20 years, and I've been a yoga teacher for 2 years. A little background into yoga, the practice can be traced back nearly 5,000 years to the very beginnings of civilization on the Indian subcontinent. The Pashupati seal is thought to be the earliest description of an asana, which is a yoga posture, and it dates from this time. The word yoga first appears in the Rig Veda, written between 3,000 and 3,500 years ago. A little background on diabetes. Clinical symptoms were first documented by the ancient Egyptians approximately 3,000 years ago, and in ancient India, the condition was known as madhumeha, which means honey urine, because they found that ants were attracted to the urine because of the sugar in it in people who had this condition. The ancient Greek doctor Apollonius of Memphis, pictured here, first coined the term diabetes, and the famous Roman doctor Galen was aware of the disease also, even though he did admit he had only ever seen a couple patients with it, so it was a little bit rarer back then. However, by the 5th century, the Indians and the Chinese had noticed that it was more common in the overweight, wealthy people. And in 1776, Matthew Dobson found that it could be fatal in some people but chronic in others. So how does diabetes look now? The most recent information I could find was from 2017, and it was then that the CDC estimated that 30 million Americans had diabetes. And the most disturbing part is that the rates are rising the fastest in children. Diabetes is now the 7th leading cause of death in the United States. So what's the connection? Well, it's always been known that the symptoms and risk factors for type 2 diabetes can be reduced through healthy diet and aerobic exercise. Even ancient doctors prescribed a healthy diet as a treatment for their patients who were exhibiting these symptoms. But is yoga considered an appropriate intervention? Because yoga isn't always aerobic, and that's what I wanted to find out. Can yoga actually make a difference for someone with type 2 diabetes? So with diabetes, naturally the first thing I wanted to look at was blood sugars. Fasting blood sugar is what's usually thought of when somebody says they're testing your blood sugar. It is how your body manages sugar without any food in it. All but one of the studies showed significant decreases in fasting blood sugar levels in diabetic groups, and most of the studies showed minimal effect of yoga on fasting blood sugar for control groups. And one study did find that there was no effect on fasting blood sugar in either group. Next, I looked at the postprandial blood sugar, and this is typically measured 2 hours after a meal, and it looks at how your body manages sugar after a meal. All but one study showed decreases in postprandial blood sugar in diabetic groups, and all of the studies showed very slight change in control groups. So the third way to measure how your body manages sugar is called the hemoglobin A1C. This one was a little bit harder for me to get a good read on because it's measured over a long term. It looks back at the last 3 months how your body has been managing sugar. So I only found 2 studies that included hemoglobin A1C, and both found decrease in the diabetic and control groups. So yoga and blood pressure. 3 of the studies measured blood pressure, and all of them found a decrease in both systolic and diastolic. Blood pressure was improved for both diabetic and control groups, but it was much more significantly improved in the diabetic groups, which I found interesting. And yoga and cholesterol. Only 2 of the studies measured cholesterol, and they found that the total cholesterol was decreased, triglycerides were decreased, the LDL, which is the bad cholesterol, was decreased, and the HDL, which is the good cholesterol, was increased. I also wanted to look at body measurements, not really in a weight loss sense, but more in a healthy body ratio sense. And 2 studies took measurements. The one that looked at BMI, it was decreased in test groups, and actually one of them was actually increased in the control group. Waist circumference didn't really seem to be much of a change, but the waist to hip ratio decreased in test groups, and it remained the same in control groups. So, a couple other interesting things that I discovered while doing this research. One study found that type 2 diabetics who practiced took less medication, and another study found that if they kept all the medication dosages constant, the fasting blood sugar, postprandial blood sugar, blood pressure, and cholesterol all improved with yoga practice. One study found that the blood tests measuring oxidative stress were improved by yoga, actually significantly with the diabetic patients. And another study found that all of the participants reported decreased feelings of anxiety, depression, and a decrease in perceived stress. So how does it work? Well, they're not really sure. The first theory, which I kind of like the best, is that certain postures and breath work cleanse and rejuvenate the internal organs, including the pancreas. And they thought that there's certain breath work and some of the twisting postures could rejuvenate, in particular, pancreas cells and help it produce more of the beta cells that are responsible for insulin production. Another theory was that just like any other type of exercise, it improves glucose uptake by the muscles. And then the third theory was the mind-body aspect of yoga, because yoga with the postures and breath work and meditation was very relaxing, and people had the perceived less stress. They think that the lack of stress and the reduced stress, even the oxidative stress on the body, helped people's blood sugars. And in conclusion, it actually works, but not by itself. I think yoga is definitely an appropriate intervention for type 2 diabetes, as long as it is incorporated with a healthy diet, lifestyle, any prescribed medications, and other aerobic exercise. So the studies I looked at ranged in time period from a 15-day residential program where the participants were practicing yoga every single day and living what's considered a yogic lifestyle to a 3 days a week for 3 months. The yoga practice in all of the studies included asanas, which are the postures, pranayama, which is breath work, and meditation of different types. The participants were type 2 diabetics and non diabetics for the control groups. They were mostly men ages 30 to 75, and only one study that I found included women.